Hello, how are you? This is our medical specialties class for Wednesday, February 3rd. The medical field is as expansive and multifaceted as the intricacies of the human body, in which each medical specialty fits to serve the needs of a particular realm of care. Specialists in allergy and immunology work with both adult and pediatric patients suffering from allergies and diseases of the respiratory tract or immune system. They may help patients suffering from common diseases such as asthma, food and drug allergies, immune deficiencies, and diseases of the lung. Types of allergies. An allergy occurs when your body's immune system views a certain substance as harmful, reacts causing an allergic reaction. Substances that cause allergic reactions are allergens. There are many types of allergies. Some allergies are seasonal and others are year-round. Some allergies can last a lifetime. Types of allergies: drug allergy, food allergy, insect allergy, latex allergy, mold allergy, pet allergy, pollen allergy. We have some types of allergies such as skin contact, ingestion, injection, and inhalation, and some examples. We in the radiology service administer contrast medium either based on iodine or gadolinium, which can cause adverse reactions. For that we have a medication administration manual. Is the branch of medicine dedicated to pain relief for patients before, during, and after surgery. The American Board of Anesthesiology outlines the following subspecialties within the field in the following areas of care: critical care medicine, hospice and palliative care, pain medicine, pediatric anesthesiology, sleep medicine. In the radiology service, some patients require anesthesia services to complete their radiological studies. Call it computed tomography, magnetic resonance imaging, ultrasound, endoscopy study, etc. Dermatologists are physicians who treat adult and pediatric patients with disorders of the skin, hair, nails, and adjacent mucous membranes. They diagnose everything from skin cancer, tumors, inflammatory diseases of the skin, and infectious diseases. They also perform skin biopsies and dermatological surgical procedures. Physicians specializing in diagnostic radiology are trained to diagnose illnesses in patients through the use of X-rays, radioactive substances, sound waves, and ultrasounds, or the body's natural magnetism and magnetic resonance images, MRIs. This is our field of work. We carry out radiological studies according to the medical requests of the specialties. It is also important to point out that in our service we have subspecialists, which I will point out below. They can also continue with subspecialty in the following areas: abdominal radiology, breast imaging, cardiothoracic radiology, cardiovascular radiology, chest radiology, emergency radiology, endovascular surgical neuroradiology, gastrointestinal radiology, genitourinary radiology, head and neck radiology, interventional radiology, musculoskeletal radiology, neuroradiology, nuclear radiology, pediatric radiology, radiation oncology, vascular and interventional radiology. It is a specialty of neurosurgery that is responsible for the treatment of vascular diseases of the brain and spinal cord, such as aneurysms and arteriovenous malformations. using minimally invasive techniques guided by an X-ray machine, digital angiography. It is a subspecialty of radiology itself that focuses not only on diagnosis but also on treatment, that is, on direct intervention against numerous diseases, always using minimally invasive techniques. Musculoskeletal radiology provides extensive experience in the treatment of diseases or injuries of the joints, bones, muscles, and spine in both adult and pediatric images. Musculoskeletal problems can be the result of a variety of circumstances ranging from work accidents and sports injuries to genetic and lifestyle choices. Some of these problems include knee osteoarthritis, bone osteoporosis, and many other joint or muscle problems. Neuroradiology aims to provide new insights into the function and pathology of the human nervous system that can help better diagnose and treat diseases of the nervous system. Nuclear medicine is a subspecialty of radiology which involves the use of radioactive medication, radiopharmaceuticals, to diagnose and treat disease. These radioactive materials are usually injected into a vein but are sometimes swallowed or inhaled. Radiation therapy, also called radiation therapy, is a cancer treatment that uses high doses of radiation to kill cancer cells and shrink tumors. Doctors specializing in emergency medicine provide care for adult and pediatric patients in emergency situations. These specialists provide immediate decision-making and action to save lives and prevent further injury. They assist patients in the pre-hospital setting by directing technicians, emergency physicians, and assisting patients once they arrive at the ER. Family medicine, FM, formerly family practice, FP, is a medical specialty devoted to comprehensive health care for people of all ages. The specialist is named a family physician or family doctor. In Europe, the discipline is often referred to as general practice and a practitioner as a general practice doctor or GP. Internal medicine or general internal medicine is the medical specialty dealing with the prevention, diagnosis, and treatment of internal diseases. Physicians specializing in internal medicine are called internists or physicians. Medical genetics is the branch of medicine that covers the diagnosis, study, and treatment of syndromes directly related to the human genome, which sometimes do not generate serious symptoms but sometimes generate hereditary diseases. It is the medical specialty that treats disorders of the nervous system and specifically deals with the prevention, diagnosis, treatment, and rehabilitation of all diseases that involve the central nervous system, peripheral nervous system, and the autonomic nervous system. There are a large number of neurological diseases, which can affect the central nervous system, brain and spinal cord, the peripheral nervous system, or the autonomic nervous system. Preventive medicine is a medical specialty recognized by the American Board of Medical Specialties, ABMS, which focuses on the health of individuals and communities. The goal of preventive medicine is to promote health and well-being and prevent disease, disability, and death. Psychiatry is the medical specialty dedicated to the study of mental disorders of genetic or neurological origin with the aim of preventing, evaluating, diagnosing, treating and rehabilitating people with mental disorders and ensuring the autonomy and adaptation of the individual to the conditions of his existence. Also in a general area, he is dedicated to the study of the brain and what is malfunctioning within it, not just mental illnesses. Surgery, branch of medicine that is concerned with the treatment of injuries, diseases, and other disorders by manual and instrumental means. Surgery involves the management of acute injuries and illnesses as differentiated from chronic, slowly progressing diseases, except when patients with the latter type of disease must be operated upon.